Hello students. So today we are gonna cover non-steroidal anti-inflammatory drugs or NSAIDs. All drugs grouped in this category have analgesic, antipyretic and anti-inflammatory actions in different measures. Starting with the classification, we have first non-selective cyclooxygenase inhibitors which include salicylates like aspirin, propionic acid derivative, example ibuprofen, naproxen, phenamic acid derivative, example mefenamic acid, acetic acid derivative like ketorolac, enolic acid derivative, example piroxicam. The second group includes preferential cyclooxygenase 2 inhibitors or COX-2 inhibitors, which includes diclofenac, aceclofenac, nimesulide. The third group is highly selective COX-2 inhibitors, example etoricoxib. The fourth group is analgesics and antipyretics, which are having weak anti-inflammatory effects like paracetamol and nifopam. Moving on to the mechanism of action, cyclooxygenase is the enzyme responsible for biosynthesis of various prostaglandins. There are two well-recognized isoforms of COX, that is COX-1 and COX-2. The cyclooxygenase 2 is mainly induced during inflammation by cytokines and endotoxins and is responsible for various productions of prostanoid mediators of inflammation. Here, aspirin and most of the NSAIDs inhibit both COX-1 and COX-2 isoforms, thereby decrease prostaglandin synthesis and thromboxane synthesis. It is important to remember that the anti-inflammatory effect of NSAIDs is mainly due to inhibition of COX-2 enzyme. Secondly, aspirin causes irreversible inhibition of COX activity. Rest of the NSAIDs causes reversible inhibition of the enzyme. We will study in details in further slides. And the third point is the COX-1 is constitutive enzyme found in most tissues such as blood vessel, stomach and kidneys. Here in this diagram, we can clearly see that the classical NSAIDs group like aspirin inhibits both COX-1 and COX-2. COX-1 enzyme is totally constitutive in nature and COX-2 is inducible and constitutive both, such that by inhibiting COX-2 we target the disease, especially arthritis and inflammatory diseases which involve macrophages and other cells, but also it targets the COX-1 related targeted organs like stomach, intestine, kidneys